National Association of Cosmetology and Medical Hair Professionals is a mouthful. Over the past 40 years, I've seen many individuals come to my office, and there's this one problem that's always bothered me more than anything else. A person comes in, they've been shedding their hair for years, or getting thinning hair, or undergoing hair loss for one reason or the other. And when they come into my office, they've tried many treatments and regimens and potents for years, and by the time I see them, they sometimes have permanent baldness. And at that point, I really can't help them. So I've always wondered, what can I do to help these individuals get the earliest diagnosis, treatment, and guidance possible? Because when they show up in my office and it's been going on for 1 year, 3 years, 5 years, that's too late. And it dawned upon me that many of these individuals go to their hair salons every week, every 2 weeks, once a month, whatever. So they may have seen their hairstylist 10, 20, 50, or 100 times before they ever see me. So in my mind, I'm a problem solver, and the solution seemed to be make some kind of connection with their hair care professional, help them to be able to identify these conditions, and be able to support the people to know what to do. So out of that is what we're doing with creating National Association of Cosmetology and Medical Hair Professionals. And cosmetology is before medical intentionally. The patient's going to see, the individual with hair loss is going to see the cosmetologist first, and usually the medical care professional second. So it's a way to get a collaboration going to help give individuals the best guidance that they need. So how does that happen? From a medical perspective, I've been trained to identify and diagnose alopecia. Alopecia is a medical term for baldness, but there's 20 different types of alopecia. Most individuals think about one. So I want to help hair professionals be able to identify and recognize different types of alopecia as early as possible. And where will they do this? Behind the chair. This is where they spend the majority of their time. So from behind the chair, detecting hair loss or alopecia is really the place it should be done first. If a person is then directed to whatever they need, that could be medical treatment. It may not need medical treatment. It could be using supplements. It could be using something to repair damaged hair that's chemically altered. But it's good for hair professionals to know as much as possible about hair loss to help these individuals. So the National Association of Cosmetology and Medical Hair Professionals is oriented to identification of hair loss, guidance to where it should be treated, and then helping the person to grow their hair back as early as possible when possible. So that's what we want to do, and we would like for you to be part of that solution. If you want to be part of the solution for helping individuals with hair loss get the professional care and guidance that they need, go to NACMHP.org and provide your email address to get our free report and ongoing updates to be part of the community that helps solve this problem. Go to NACMHP.org, give us your best email address, and we'll send those reports to you right away and get you on the list.